I'm sharing my screen, I can't see everybody, but I'm confident that you're there. So welcome to the offer holder evening for C21 North. This is us here this evening with you. So I'm Nia Jones, I'm the interim programme lead for C21 North. We have Professor Mike Larvin with us, and I'll let everybody introduce themselves, but is our Executive Head of School, Dr. James Burston, Year 2 lead, Joe Briggs, Lucy Simmons and Firaz Hamdan, and we'll go around everyone. If you don't mind, if you'd just like to say hello and who you are. Lovely.
Hello, I'm Lucy. I work in Cardiff on the managing the partnership, and I shall pass to Mike.
Hello, can you hear me?
Yes, Mike.
That's great. I'm Mike Larvin. I'm Exec Head of School, and my clinical background is I'm a general surgeon. Pleased to meet you.
I'm Firaz. I'm currently a fifth year medical student, well, final year medical student as well.
I'm Jo, and I'm the C21 North Wales admin team leader.
Hi, good evening. My name is James Burston. I'm the Year 2 lead for the C21 North Wales programme.
Lovely, thank you all. And so this isn't the whole team, but there's a good representation of the team here. And so this is your evening, really. We're delighted to be here with you and to welcome you. And it's a very informal session. The more you interject and ask questions, the more we can help, and we would enjoy that. And obviously that goes for the team as well. Please jump in at any opportunity. So we will discuss C21 North and the 4 years that you will spend with us, years 2 to 5. We'll talk a little bit about Bangor MedSoc, but maybe Firaz will do that for us. Any myths that there might be out there, and please, any questions. We love questions, and if we can't answer them, we'll get back to you. I do have to say, Firaz, I almost put a doctor in front of your name. But looking forward to doing that very soon.
Nearly there.
Nearly there, absolutely, absolutely. So C21 North, we're delighted to be running C21 North here at Bangor. And as Firaz will be able to answer more than and better than any of us, he's been here with us for the 4 years and has experienced the years with us here and was one of the pioneers, the students to join us and to embrace this new programme with us. And so you will be our final cohort, and so we're delighted to welcome you. So C21 North, as you're aware, is a partnership between Bangor and Cardiff, and you will be with us in your final 4 years of medical school. And just to say, you will graduate with a Cardiff degree. And I think it's important to say that. Somebody asked me that, one of our students, not long ago. And even though you do all of your placement with us here and your course with us here, you will graduate from Cardiff and with a Cardiff degree. For the first year that you will be with us, Dr. James Burston is our Year 2 lead, and we're able to expand on this more, but you will mainly be with us at the university at Bangor. You will still have patient contacts as they do in Cardiff and as we run here in terms of your CCL, which is your community clinical learning, and we encourage that. And so you will experience both the hospital teaching and primary care teaching within your first year with us. And I have to say, North Wales, in terms of its clinical teaching, has a great reputation. You know, Cardiff students come here and join us. Swansea students come here and join us. There's students here from Liverpool and Manchester, and we have feedback regarding their placements, and it's always been very well and warmly received. And that's generally because we just enjoy having students here. You know, there's not a lot of students up here in North Wales currently, and so you know, our clinicians and our colleagues within BCUHB and primary care are delighted to have students and can offer a great experience for you. And so, as I said, we've welcomed our first cohort for C21 North in 2019, and they are currently in their final year. And Firaz is here with us tonight, which we're delighted. Just come back from elective and going into final placement now. We have up to 40 placements, well, 30 placements, I think we were going to be having this year, wasn't it, Mike, for September? And I'm not sure if we're going to fill that. So you are going to be a fairly small cohort, but a maximum of 30 of you will be with us in year 2. But we're not sure in terms of those numbers haven't been finalised just yet. And we're delivering exactly the same curriculum, learning outcomes and assessments as Cardiff. But we are able to deliver it in a slightly different way. And because we're a smaller cohort, we're able to do that. Any interjection by anybody so far? So why C21 North? Well, as I say, you will be in a smaller cohort. And as a result of that, we will get to know you. You know, that's one of the real pleasures for us as both faculty, and hopefully, you know, that's what will benefit and help and support you through your 4 years. Mentioning that again, we've had excellent feedback for clinical placements from our partner, and it's Betsy Cadwallader. They're the 3 hospitals. We have 3 hospitals in the north: Wrexham, Ysbyty Glan Clwyd and Ysbyty Gwynedd. And there are 3 hospitals that you will be attending, and multiple primary care practices are engaged and work with us. We do have new facilities here, which we hope that you will make the most of during your time. Our anatomy will not be from the use of cadavers. They'll be taught in a 3D, using a 3D anatomage, and that's how we teach our anatomy along with our anatomists here. And there is a new clinical skills centre, which we will encourage you to use as well. In terms of interprofessional education, we will be developing that and expanding on that, and hopefully through your years and in your placements as well. And so you will be learning through teams, which I think is ultimately how you will be working as well when you qualify as foundation doctors. It's just an image of one of our METI, I think that's our METI man in Fronhaelog. So we do simulation training here, both within the university and within the hospital sites as well. I suppose the main difference between us and Cardiff is our year 3. And this is our longitudinal integrated clerkship. Now this year, the year 3 will not be block teaching, how they deliver the year within Cardiff. It will be that you will be in primary care for 10 months, with 1 month within hospital front door. All of you will be given this opportunity. We don't deliver block teaching here. All of our students have the LIC. Some of your friends, possibly from Cardiff, or will be coming up for a year to do this on a carer programme, but all of our students here in Bangor will be given the LIC. The LIC, the Longitudinal Integrated Clerkship, it is fairly new here within Wales, but not internationally. And the medical education has been tried and tested, and it's been shown that the more immersed you are within clinical practice and the same clinical practice, and in particular primary care, you do develop a greater critical thinking for your skills. You become an integral part of the team because you get to know the team so well, because you're there for a much longer period, and you have more opportunities to consult with patients, either independently or observed, with then sharing that information with your supervisor. You won't be doing anything alone, but you'll be able to take histories and examine your patients alone if you feel supported and safe to do that later within your year 3. And the reason that that happens quicker within year 3 within an LIC is because you've got to know your supervisor so well during that time, and then you. So your history taking, your examination skill really do become quite honed and well developed. So we have a video here, and who better to sort of tell you about C21.
choice for me, just because the views around you are so breathtaking, and it just really helps put things into perspective for you.
Could you turn the volume up a bit, Nia?
Is the excitement and welcome that students get here in North Wales.
Students are here. We love to have people there keen to learn, and we want to support them in that. And we are curious, and we like to share that curiosity.
We have got a long history of teaching medical students successfully on clinical placements, but there's just such a buzz about having our own students here in North Wales. This program will create great doctors because of your unique experience, because of how you're made to feel as part of the team here.
The thing I enjoy most about the teaching is the fact that we're a small group, so we have more face-to-face sessions with the tutors and get them to ask all the questions.
Everyone is very keen to help, and this provides a very good working environment in order to ensure that students are successful.
What's unique to us here is that we can offer everybody the LIC in year 3, and that's such a unique opportunity for students to have that close relationship with their education supervisor. You'll really get to see what it's like and learn from the doctor.
Being able to spend time in general practice and really help me get to grips and have motivation.
Students have got great experiences at our hospital. And the special thing about our hospital is that the staff is really committed to looking after students.
If you absolutely love outdoorsy nature environments and breathtaking views, there's so much to do. But also, if you just want to be part of a really kind of close-knit community of medical students, it's such a fantastic way to learn because everyone helps each other.
Like career as a medic, flourishing as a medic, it's a marvelous experience, no matter which sort of career pathway you actually eventually take in medicine.
It's a fantastic opportunity after all. I wouldn't be anywhere else studying medicine.
And so I'm sure you've seen spotted Firaz on the video there. So thank you for that. And that's sort of, and I'm sure Firaz will be able to answer any questions that you may have about that. There's also a Bangor MedSoc Society, and I won't mention too much about that. I don't know, Firaz, if you want to say something about that now, or
I don't mind. Is it coming up later, or do you want me to say a quick few words?
Perfect. Yes.
Yeah, so Bangor MedSoc, it's basically a society like any other sort of medical school where we're basically all represented by medical students. The chair is also a medical student, and we basically try and integrate and put on events, whether they're academic or social events, for all medical students. We try and enforce any changes that medical students want academically by talking, sort of having good communication with staff. And yeah, basically we just sort of represent everyone in the school and try and put forward anything that people want and try and integrate students as much as possible.
Yeah, and it's across all years, isn't it?
Yeah, so we have, yeah, exactly. So we're representative of all the years, and we have sort of medic families to try and integrate sort of year 2s all the way to year 5s, which is quite a nice concept. So we try and make everyone sort of feel as comfortable as possible from the minute they arrive to the minute they finish, really.
Yeah, that's brilliant. And again, not just from a social interaction, you know, that's really important from an educational point of view, you know, that just sharing of ideas and experiences across the years is just so important. And so myths that we may have. So we do hear this, that the LIC is just for people who want to be GPs. And this is categorically a no. You know, the LIC is the best place to develop you in terms of becoming a great doctor. And it's for your medical education. And that's why more patients now have their care within the community, you know, care closer to home. Patients spend less time in secondary care or in tertiary care. And so if our patients are in the community, as students, that's where we need to be able to learn off them, to be able to have that patient-centered learning. And so if that's where our patients are, that's where we need to be in terms of our education, in terms of learning. And the year 3 is really not about becoming anything other than, you know, the best year 3 medical student that you can be, you know, to be able to take as many histories, to examine as many, and to get you feeling more comfortable in a clinical placement. And that's why we have the LIC here. Apparently there's nothing to do in Bangor, we hear that, and hopefully Firaz will be able to talk to that as well. And you know, occasionally I'm amazed at what some of the students tell me that they've been doing, you know, and how full and active a life they have outside of the course as well, which we would encourage you to do as well. We are here to support you through the course, and we're very aware that this is a very demanding course, you know, both in terms of academic and in terms of the clinical placements and in terms of the moving and the geography. And so we want to support you as much as that. And the happier you are here in Bangor, the more you will thrive with that. I'll be disadvantaged compared to my peers in Cardiff if I do the C21 North Wales programme. And I think that's why it's delightful, you know, I'm chuffed that Firaz is here today, you know, because that just sort of tells you no straight away, doesn't it? And it's not as though I need to convince you of that. Our students are doing just as well in terms of in all their examinations, and will be graduating this year. And that's a picture of our year 5s on their last teaching week with us in February, when we had a leadership day. And so we're delighted that our first cohort will be graduating in June. And so, yes, hopefully that answers that last question, really. But if you do have any questions, please, we are here. I'll stop sharing now, and you can meet the team properly, and we can meet you properly as well. Any questions? If you feel more comfortable in the chat, that's fine as well. Oh, we do have a question from Lucy for Firaz. Would you share what you recall from your 3rd year?
Yeah, of course.
Thank you.
Yeah, as Nia said, 3rd year can be a bit strange when you first start it, because the idea of spending a whole year in primary care is quite different to you know, Cardiff or your peers in other medical schools. And it can sort of, you might hear from other people that you're meant to be, you know, they're trying to make you a GP. Realistically, it's not about that. It's really the skills that make you a good GP, make you a good doctor, and you can take them out, you know, take them outside of 3rd year, and they really sort of help you with your skills and your learning as a doctor, and, you know, once you graduate. I think for me, the biggest thing about 3rd year is that you really get to have sort of your own responsibility. You get your own list of patients from very early on. And through that, you know, through doing your own consultations, you learn how to take a really good history. You learn how to sort of the really basics of being a good doctor, sort of good communication, learning sort of different people's needs, encounter people from sort of all walks of life, different religious backgrounds, different cultural backgrounds. And those are sort of skills that sort of go under the radar for a lot of students working in hospitals compared to primary care, because often in hospitals, you sort of you're shadowing, you're just following doctors around. You don't really get as much responsibility. So definitely, I found personally, I know a lot of my peers did, that when we got to 4th year, we were actually better than our Cardiff peers at just sort of having, you know, ownership of, you know, we know what we're doing, let's go speak to a patient, and just being able to chat to a patient about everything and anything, really. And just really focusing on that history taking. And by the end of year 3, you're very, very good at it, because you just do it so often. So I wouldn't worry about, you know, if you don't want to become a GP, I don't want to become I'm not sure I want to become a GP yet. Not to say there's anything wrong with being a GP. It's just more, I got my specialty in mind. But either way, whatever you take from it, you take something positive. So that's probably my best experience of year 3.
Thank you, Firaz. What specialty, which specialty is lucky to have you?
I'm thinking of going down paediatrics, but I can do GP with specialist interest. So,
excellent.
You know.
Excellent. Sorry, Mike, you've got a hand up.
Yeah, it was just to butt in. the last 4 medical schools I've worked in have had an LIC, and in each case, obviously I'm a hospital-based clinician, but in each case, the clinicians receiving the students who just finished their LIC, be year 4 here, have commented how much better prepared they come for hospital attachments. And we know 90% of healthcare is actually delivered in primary care. So there are 2 advantages of the year 3 LIC as I see it, as someone on the other side of the hospital GP fence. One is there's a great variety, as Fraser said, you see a little bit of everything. And I presume you must have seen a lot of children, Faraz, and it probably sparked your interest in peds. So, you know, spending a whole year in general practice does not mean you have to become a GP. I think probably more people think about it more seriously having done it. I got 2 weeks of general practice, so I didn't choose it. If I'd had a little bit longer, I might have done, I suppose, but I became a surgeon. So it doesn't constrain your career choices, but globally it is felt quite strongly, as Neera has hinted, that it's a better preparation for your clinical placements. And I have to say, all 4 medical schools I've worked in most recently, I have to admit, GPs get the best student feedback. And I think that's partly the one-to-one relationship that you develop with, you know, I would have 6 students with me on a surgical ward round. I do my best, but I just can't compete with gifted solo artists like GPs who do take medical education very seriously. And they're carefully selected, the practices that we use in North Wales. So as a non-GP, I'm probably in a good position to say, I think it's a really good idea. And the feedback we've had so far, the evaluation that's being carried out by Katie Webb, who's Reader in Medical Education in Cardiff, has been that the higher order thinking is a little better. And students are doing as well, if not better, than students who start with a hospital attachment. So I hope that's reassuring.
We have a question in the chat. Thank you for that. What are the opportunities for exploring surgery and obs and gynae? Do we have placements in these areas?
Yeah, so for obs and gynae, in your 4th year, you'll have it will be one of the 3 rotations that you do. So by rotation, that is 8 weeks of placement. So you'll get 4 weeks in obs and gynae and 4 weeks in pediatrics. And in those 4 weeks, you really get to, it's really, you get in what you, sorry, you get out what you put in. So if you go into placement sort of, you know, regularly and you get to know the midwives really well, they're more than happy to sort of accompany you and accommodate you. We're seeing sort of whatever you really want to see. For the obstetrics part, for the gynecology, again, if you get to know sort of the doctors really well and the consultants, they have loads of clinics that you get to sort of participate in. And the good thing and sort of almost a unique thing about North Wales is that because we're quite a small cohort, opportunities aren't sort of they aren't diluted. So you can pretty much do, you know, if you put in the effort and, you know, try and seek out any opportunity that you want, you can pretty much get whatever you want out of it. So I got the chance to see sort of 2 or 3 live births, a few C-sections, which is, you know, it was amazing. So yeah, obs and gynae is a really good placement. And then in terms of surgery, you get a week in anesthetics, which is basically accompanying the anaesthetist during all types of surgery. So you get to see sort of a variety of surgeries there. And then also, again, outside of that week, you can pretty much, if you do want to see surgery, throughout the 4 years, you get opportunities to do something called SSCs, which are essentially sort of mini projects that you can organize yourself. And if you're interested in surgery, you can link up with a surgeon, do a project with him, and then they'll be more than happy to accommodate you in surgery. So hopefully that answers your question.
That's great for us. Yeah, that's exactly what I was going to say. In terms of surgery as a block, we don't have that. But in terms of your year 3, what we encourage you to do is to follow patients as much as possible. This was slightly harder for Firas because of the COVID restrictions that we had in place, but this is very much changing now. We're very much encouraging our year 3 students to follow their patients from primary care into secondary care. And so, you know, if your patients are having surgery, or you could go and observe, and that there's ways of doing that. And we can help you, support you to do that. You also do something called an oncology project in your year 3. and possibly your student will be having, your patient will be having surgery, and you'll be able to follow and get to know people in that respect. And so there are opportunities to do it within the year, but definitely if that's something that you really has sparked an interest, as Firas was saying, a student selected component, which is an SSC, which also runs alongside year 3, you can do it within that and have a day a week, possibly with a surgeon observing surgery. Some of the SSE projects that the students do are fantastic. And I'm sure James would agree with that as year 2 lead, and because SSE starts in year 2 as well.
Absolutely. Thank you, Nia. Just had a question from Lucy. James, could you highlight how we integrate the undergrads and GEM cohorts at the beginning of year 2, please? Yeah, so obviously the big difference here is that as GEM students, they're coming in 3 weeks earlier to do summer school. And then the year 2 students who will be transferring up from Cardiff will be coming in at the end, just after the end of summer school. So in terms of integration, there's a lot of conversations we have with the GEM students about making the year 1 students feel, year 1 transfer students feeling welcome, because obviously they'll start to gel together a little bit. And ultimately we don't want to disencourage them, the year 1s, from being able to join with that. So there's a big part of my role is to encourage that open sort of friendship and dialogue groups. We also do a number of things in the year 1 around sort of social aspects, and we do a sort of an icebreaker afternoon, evening, where we get a number of people involved in the delivery of the med school program together with the year 1 transfer students, with the GEMs. By this point, they'll have had about a week to transition together. And we'll do a number of things around that, and also providing support for people who might feel, you know, a little bit that they haven't had that same gelling experience.
Thank you, James. Possibly another question for you and Firas. What are placements like in year 2?
So Firas, do you want to come in first?
Yeah, God, it feels a while ago. So year 2 is, so we replicate Cardiff in Bangor. So year 1 and year 2, if you're an undergraduate, you're doing something called cases. And I think you get 18 cases throughout the 2 years, split sort of equally between year 1 and year 2. So in year 2, you are sort of doing cases you're doing a case every 2 weeks. But the good thing about both the way Cardiff, C21 and C21 North Wales is taught, is that in between cases and while you're doing cases, you get to see patients, you get to go out to GP placements and go on home visits to see patients that are sort of related around that topic. So for example, you know, if you were doing knee pain as a case, you might get to go see a patient that's, you know, had a total knee replacement or something musculoskeletal, and you get to sort of take a history from them, and you get really like early patient contact, and it's the benefit of sort of doing this course and the way it's structured. So you get that sort of placement, I guess, with every case. I can't really remember what else we got.
Fine, thanks, Firas. I'll come in on that. Yeah, so basically the whole of year 2 is structured around cases, basically. So you'll generally have cases delivered over 2 weeks. What there'll be is the opportunity to go within, normally on the Thursdays of those weeks, to engage in clinical learning. So that will be a case of either going to a GP surgery to sit with a patient, to consult with a patient, might be going to speak to and see a midwifery presentation, basically. And generally those GP sessions that will normally be once every 2 weeks, basically, will be aligned with that case. So as Firas was saying, it would be a knee pain case, it might be a musculoskeletal consult. If it's a diabetes case, it might be actually going to speak to people who've had diabetes for a number of years. Again, the students have just come off case 15, so that's a lower GI. So that will be speaking to patients who've had a stoma fitted, for example. So all the clinical experience, although there's no placements, all highly structured around the cases.
Thank you both. What are the assessments and exams like across the 4 years? I suppose that's from our point of view and from your point of view, for us. Yeah.
Okay, so correct me if I'm wrong, because again, it's been a while. But year 2, it's mainly based sort of around. So first of all, there's exams called progress tests, which you do from year 2 all the way to year 4. So from the start to finish, and basically they're exams that are targeted in a way where they're set. The same exam is pretty much set for all the years, but they just want to see that you're showing progression. So you're getting better as the years go on. So in year 2, you're not expected to do amazingly well. and don't be disheartened if you're getting sort of low scores to what you're traditionally getting back in your previous degrees, because it's very normal in medicine. And you get, I know the structure's changed again, I think you get 4 a year now, and again you're supposed to show progression within those 4. James will be able to tell you a bit more about sort of that specifics. And then additionally, in year 2, you get something called the S2 exam, which is mainly based around science and your understanding of the concepts that you learn through your case studies. And then year 3, and basically year 3 and year 4, you get sort of projects, whether they're oncology projects or SSCs that you get assessed on. They're not typical exams, they're more sort of coursework really. But they're sort of opportunities to explore different avenues in medicine. But they're not, the main exams really are the progress tests that you need to be able to pass to progress through the years.
And ISCEs?
Oh, yeah.
That's okay for us. I always forget about that.
Yeah, no, that's that. Yeah, so ISCEs are the practical examinations. So they're the ones that are face to face, and that's traditionally you get sort of 8 stations, and you get an actor or an actress, or a real patient, in fact, and you're basically meant to show that you can act as an F1. So you'll be doing history takings, you'll be examining, you'll be asked questions about management, diagnosis, differentials, and that's mainly done in year 4. Year 2 is a sort of a practice one, I guess, or it's not really practice. But...
No. So there is a practice one and a summative one. Yeah.
Yeah.
So right.
Yeah, my year got interrupted with COVID, so everything's a little...
Oh yeah, of course. Yes.
Yeah, but yeah, so you do one year 2 and year 4, and they're much sort of more practical in-face examinations.
And Joe's our assessment admin lead. So any tips, Joe, for assessments?
No, just work hard.
Yeah. And I suppose that's the only thing, being a small cohort, we will try and make the environments as relaxed and as supported as possible for you. We do know that these are stressful exams, but essentially you'll be examined on your science knowledge. We examine 4 domains, which is science, scholarly, which are what Firaz was saying in terms of the projects, practical, you will have a practical skills logs, there will be skills that the GMC, the General Medical Council, ask us to make sure that you are competent at doing by the time you are F1 doctors, and professional. So these are the 4 main domains where we will assess you in throughout the 4 years. And the progress test, although it is very big, it is something that the reason we have them is to, exactly as Firaz has said, is to show that progression, but also if you're not progressing, possibly as a rate that we would expect, that we can support you, that we can bring support in quickly and early so that we can help you to get back on that trajectory that we would expect you to be on. And so it's so that we can react quickly to any changes.
And they're no different to Cardiff. We do the exact same.
Excellent, thank you. Yes.
And part of the rationale I would bring in about those progress tests, you might be thinking you'll actually get to sit one of these as a formative progress test at the end of year 1. So you'll get to see what that is very much like. But the thing about the progress test that's important is that they also prepare you to being an F1 doctor, because we don't only just test areas that come up on the map to the curriculum, we test on areas that you're going to see that's common and important as an F1. So part of progress tests to prepare you to be an F1 doctor as well.
Thank you, James. Does Bangor offer the elective programme like Cardiff? We most certainly do. Can you imagine if we tried not to? And Firaz is just home from elective. So, yeah.
Yeah, so
sorry for us. Thank you.
Elective programme, and it's really your opportunity to essentially it's split into 2 parts. Really, you get a first part, which is the medical elective, and that's your opportunity to sort of go and explore how healthcare is delivered in another country. It doesn't even have to be another country, it can be in the UK, and you might be able to explore a certain specialty that you're interested in, and really go and try and sort of grab that opportunity to spend 4 weeks of knuckling down on something you really want to do. I did mine in the Middle East. I've had friends that did it in Sri Lanka. There's some that have done it in St. Lucia. Loads have done it in the UK. So really you get people like medics going to all sort of parts of the world. And then the 4 weeks after that really is it's a bit more relaxed. You can do, you know, medicine if you want to, but really it's your opportunity to sort of go and have fun in a way. It's more just, you know, relax a bit more, and it's traditionally what, you know, the staff might not say that, but I mean, most medical students would treat it as a bit of a more of a relaxing time than your first 4 weeks, which can be, you know, intense if you're doing medicine.
There is an assessment with the elective, and
Yeah.
it's just a reflective piece that we ask you, and I'm sure Firaz has spent hours on that and completed it in a timely fashion. Yes, so essentially, yes, we have the elective and we encourage you. We will try and support you to enjoy it and to do whatever you want. But just as Firaz has said, there are great electives within the UK as well. So you don't have to go abroad. You know, we've had students go to tertiary centre for paediatrics, for example, in Manchester, in Liverpool, in London. So there's opportunities to do all sorts, and we encourage you to think as widely as possible with that. Firaz, what has most surprised you about being in North Wales to study medicine?
I don't know if I wouldn't call it a surprise. I think it initially, because I think a lot of us were from sort of large cities, there's an adjustment period for a lot of us in the first few months, which is so natural for even when I talk to sort of my friends in year 4 and in year 3 and year 2 likewise, there's that initial adjustment period, which can be a bit of a surprise or a shock. But, you know, you get in that sort of period, you get to meet everyone, you really sort of settle down. And once you've settled down in Bangor, genuinely you start to see sort of all the positives come through. It's nice having a small cohort. It's nice being able to sort of interact with all the staff. Everyone knows you on a very personal level. That carries on into hospitals. Sort of most of the doctors know who you are because there aren't traditionally many medical students in North Wales. You get close to sort of your general, you know, your GPs, and it's a very sort of a family vibe when you progress through the years. So I'd say it's not so much a surprise, but it's you start to see the uniqueness of Bangor, and then you start to explore North Wales. You know, summer in North Wales is amazing. Really make the most of that. And if you're an outdoorsy person, you know, Snowdonia's literally around the corner. So yeah, that would be my sort of, not surprised, but I guess once you've got over that sort of that initial period, you get to really sort of find, you know, the best things about North Wales.
Just to say, in the winter as well, there's no such thing as bad weather, just bad clothing. So we'll get you out there. We'll get you out there and support you with that. And I think that's very, very honest of us. And I think that transition or change anywhere can be difficult, and we will try and support you as much as we can with that. For example, in Manchester, you know, for clinical years, many students go to different areas, and they're still very much Manchester, but it is different areas, and that can be a period of adjustment as well. And so we're aware of that, and you know, I would say encourage you to talk to us about that. And if you are having difficulty, just, you know, do let us know. We can help with that.
But I think if I can come in on that, Nia, I think one of the nice things about having the small cohort sizes, and Firaz, feel free to interject if you don't think this is true, but I think because you have a small cohort, bonding between that group becomes really useful, and everybody seems to know each other really well. And I think there's a big strength in that.
Yeah, I agree. Any more questions that we can help with? Lucy, you've been keeping us on track as well. Anything you can suggest that would be useful to know?
And we had a student finance question, which I've shared the answer to. There's always a particular email to contact about that because it's complicated per person. So it's very individual cases. Otherwise, yeah, I don't know.
No, wonderful. Thank you for doing that as well. Yeah. Wonderful. Please feel free to add in any other questions that we can help.
I would say, because I've been asked this by previous students in previous years, is accommodation when you first arrive to Bangor. I'm not sure what degrees the 2 students are on, but we try and make a Facebook group for all the students to begin with, so that you can, because it can be sort of a little bit unsettling not knowing where to live in Bangor, but we try and make sort of a Facebook group. So I'm not sure if you've been given the link to that, but that'll have, on that Facebook group, there'll be students from years above who'll be able to sort of advise you where's best to live in Bangor and what's close to what. But more importantly, you'll be able to sort of hopefully meet your fellow students from the same course as you, and then you can sort of work out where to live and find houses together. So that transition period is slightly easier for you guys.
So first, do you guys do sort of medic families as well?
Yeah, so yes, as I mentioned this slightly earlier, but the Bangor MedSoc, we set up like a essentially what's it called, like a concept called Medics Family, which Cardiff also do. Essentially, that's the way to bond year 5s, year 4s, year 3s, and year 2s all together. So I'll be a great granddad by the time I pretty much leave. But so everyone's got like a medic daughter, and essentially you'll be paired with people in years above who will be your source of information. There'll be the people you can contact if you need any help, any advice about academics, social stuff, and that sort of we do sort of social activities to try and bond everyone together. So it's a concept that we're quite proud of setting up, and hopefully it continues for a long time.
Yeah, that sounds great. Another question, great. How's the cultural diversity in Bangor, especially for ethnic minorities?
It's difficult questions to answer because it's such a small cohort, so it's very difficult to be representative of all minorities. But in our cohort, we've got students from all different types of cultural and religious backgrounds and ethical backgrounds as well. And then if you ever did feel sort of isolated, there's so much support, and there's the really good thing about Bangor, I should have mentioned earlier as well, all the societies are free. So there's for example, there's Bangor Arab Society, there's Afro-Caribbean Society, and there's a lot of societies for all sort of backgrounds. So it's really easy to sort of join those societies, meet people from the similar backgrounds to you, and then from there you can host events that sort of bring everyone together. So it's I'd say from that point of view, it's good.
That's good. Yeah, and I suppose that student population would have that diversity in it. In terms of the pool of patients that you will come into contact with, that does largely depend on where you're placed within North Wales, and that will be very much dependent on where you are. In terms of also the Welsh language, I don't know if this is an opportunity just to mention that as well. Some of your patients will be purely Welsh speakers. These will be extremes of demographics, very young and older patients, possibly patients that you might meet within either sort of in your primary care or your secondary care placements. When they're poorly, sometimes they revert to a language that they've become more comfortable with, and this can be Welsh. And so we do support that. We would encourage you to learn sort of basic phrases and sort of ways of communicating. We would encourage you to do that. We will support you to do that as well through the university, but it's in no way essential, but it can be very much valued by our patients. And I would say, even though that's sort of unique to here in terms of the Welsh speaking population, when I worked in Manchester, I used to teach on the same course in terms of Mind Your Language, because there would be so many of our patients within Manchester who didn't speak English first language, and so we would encourage our students there to try and be able to have basic communication, verbal skills within the language that their patients would be most comfortable with. But we would very much look at the Welsh language not as an obstacle to you, but very much as an opportunity to learn a new skill. And to use that to your advantage, really. And I think Lucy's put in the chat about Coleg Cymraeg, which is something that would help. Would anyone like to add anything onto that?
The programme sits into the possibility of studying in the higher percentage, doesn't it? So that they can apply for the higher level Coleg Cymraeg.
Yes, yes, definitely, yes. And if you're a Welsh speaker first language, we can help support you with that as well. And we would encourage you to submit some of your assessments, if you're comfortable, through the medium of Welsh. We have assessments that we're able to offer you through Welsh language, and we would very much encourage you to speak to us about that. And we will support you as much as we can. And also, just to if you did want to do that, you know, sometimes with translating projects, that can be a real issue. We will try and market for a Welsh speaker first language to mark your projects as well. We probably have the faculty to be able to do that. Would you agree? Yeah, Joe.
Yeah, absolutely.
And also, yeah, just to let you know that there will be, as much as we will encourage you to have peer support within our own cohort here of C21 North, bearing in mind that C21 South students come up to North Wales on placement as well. And so you will have an opportunity to mix with your peers from Cardiff as well, both in higher years and lower years as well. And we've just been down to Cardiff, haven't we, Firaz, at the Science and Practice Conference, where that won't happen a lot through your 4 years, but where it can happen, we do encourage that.
Yeah, and to add to that, when you're in year 4 and year 5, all your rotations, if you're not in Bangor, it's easier to integrate with Cardiff medics because you're put in the hospital accommodation, both in Glenclwyd and in Wrexham. So you really get to integrate with your Cardiff medics while you're there.
Yeah, and I think that's, I saw that last week. You all very much, you know each other, you know, yes, exactly, which was really lovely just to that, you know, that you're mixed with your peers as well. And you know, get to know what's happening there, and so yeah, the sharing of information, that's so important, what we would want for you to continue, really. I don't know if you're aware of an MLA examination coming through. That's just come into my mind from the assessments question that you asked. You may know about it or you may not. It's a new examination that the GMC are introducing, and it will be in place in 24-25 academic year, 24-25. So absolutely, you will be sitting the MLA. And just for you to be sort of reassured, really, there is a plan in place, and we're very happy to discuss that with students. And in particular, our students in year 3 now, they'll be our first ones to sit it, where we're in discussions with them about it. And that's something that we can do with yourselves as well. And that's something that all students throughout the UK will be sitting. So we're not different here, but we will be doing it the same as your Cardiff counterparts. Any other questions?
I'm just going to put a link to the main Bangor Uni website, because it feels like something we don't highlight enough, that actually student perspective on studying in Bangor ranks Bangor University so highly. This second university in Wales, and it's the #1 most affordable university town. There's various stats that are on the front page that I'll share through this link to everyone.
Thank you, Lucy. That's lovely.
Sonia, do you mind if I come in on something here?
No, not at all. Please do.
So it's just sort of going through a list of common questions I asked by year 2 students. And one of the big ones is in terms of assessment, basically in terms of, obviously in Cardiff, there are exam boards, and how do we manage that up here? So obviously we're linked very much to the Cardiff Assessments Programme, basically, and we have members of our faculty that sit on the exam boards as well. So it's equal representation, whether you were a C21 student down in Cardiff or a C21 student up in North Wales, basically.
Thank you, James. Yeah. And on question design and writing papers as well, there is cross collaboration for that. Yeah, thank you, James. I'm aware of time. Shall I just go around our room here so that just anyone can sort of say a final comment, or just to bring to a close? Should I put executive head on the spot and start with you, Mike?
Yeah, just big thanks to Lucy for organising this. We're aware there's only 2 of you on the call. That doesn't matter to us. You're very important to us. Obviously, we want the best for you. But thanks again, Lucy, for organising it. Really appreciate that.
You're welcome. And the recording will be shared, so anyone who couldn't come today will be able to watch what we've said and we'll give them opportunities to get in touch directly.
Great stuff.
Thank you. Joe?
Just thank you for coming, and we hope to see you in September.
James?
Yeah, no, thanks for coming. I know there's only 2 of you on the call, but again, that drives very much with the fact of, we're a small cohort, and we look forward to seeing you in September. And I look forward to getting to know you personally.
Firaz?
Yeah, I had a great 4 years, so I'm sure you guys will too. So hopefully you guys come up and we'll see you in 4 years' time in a hospital somewhere.
Lucy?
Sorry, couldn't replying to a message as well as unmuting on screen. Yeah, great. Diolch, Bob. That's great. Yeah.
Oh, excellent. Yes, and just for me, thank you both for writing in the chat. Thank you for engaging with us. Thank you for attending. And to those of you who are not here, we look forward to welcoming you. If we can help in any way between now and then, please get in touch.
Yeah.
We'd be more than happy to answer any questions, but we very much look forward to welcoming you here in September. And good luck with the rest of the year in whatever you're doing. Have a lovely summer, and we'll see you in September. Diolch yn fawr.
Diolch, thanks everyone.
Yeah.
Thank you.